I'm exploring the inequities in health between women. If you think about how many of us have been involved for a long time in research on gender and health, and it's taken various different forms if you think about it. I mean, in the early years, women got together and said, we're a group, we're a sisterhood, we're actually unified by the fact that we've got the same reproductive systems, and that makes us different from men. So from that point of view, women came together as a group, as a single group, saying these are our needs and this is what we want to fight for proper reproductive health care. So it was very much seeing women as a homogeneous group. But as things moved on, thank you very much, people gradually, gradually began to recognize that there was a difference between biological sex and social gender. And that's very important to remember those concepts as you're thinking about equity in relation to women and to men. Because what it means is that women are in fact united, it's true, by their biological sex, and they do all have the same reproductive needs. But on the other hand, their lives are structured in very fundamental ways by their gender, by the fact that they're women, socially. And of course the same thing applies to men, that men's lives are also structured by gender, which we don't always remember, so that men's health can be affected either positively or negatively by the fact that socially they're defined as male and therefore they have to behave and do things in terms of being a male. But what that meant was that as that kind of division between biological sex and social gender gradually became apparent, and people started to write about that and think about that, that became translated into policy. And so if you look at policy documents now, international ones and national ones too, what you find is that there's quite often, not always, but often an emphasis on gender equality. And if you look up gender equality on any of the internet search machines or anything, what you find is gender equality equals the fact that societies create men as having more power, more resources, more whatever than women do. So that there's a socially constructed inequality between men and women. And that's how we've mostly been thinking about it until actually quite recently. And what I want to do is to talk about why that's absolutely important, and we'll keep on talking about it. But when we talk about equity in relation to women, that's by no means the only thing that we should be talking about. So what I want to explain is why the notion of gender equality or inequality, as it's normally used, has quite significant limitations. The first one is that, as I've said already, inequalities between women have received very little attention. So it's been mainly a focus on women versus men, but not how do women themselves have unequal experiences and therefore unequal health. So that's the first problem. The second problem is that there are very few studies, indeed, which have actually explored these inequalities. And the statistical data that we get, to the extent that we get it, in many parts of the world, doesn't disaggregate between women and men, and doesn't give us the opportunity to be able to see how there are differences between women. So the data that we have that would talk about, if you like, you could call it class and women or socioeconomic status and women or whatever, but the actual inequities between women themselves tend not to appear in statistics. We tend to have disaggregated statistics that don't really help us to solve this problem. And what that means is that we actually have very little understanding of how women's health is either harmed or promoted in different settings, because different settings, different countries, different contexts will have a different impact on the health of women.